Welcome to Scope. This brief tutorial will explain to you how to access Scope services to help you with your complex patients. My name is Pauline Pariser. I'm the primary care lead for Scope. Scope began as a partnership between Women's College Hospital, University Health Network, the CCAC, and expanded also to include Mount Sinai Hospital and the HealthLink. After you watch this tutorial, you will receive an email that will get you started on using these services. Scope is a single point of access. It provides you with one number to call so that you can access the whole team by either one number or one email. Think of it as a virtual interdisciplinary team that's built around your practice, an expanded set of resources that goes beyond your office staff. So the 4 members of the Scope team that you can access through that one number include the internist. When you press 1. If you press 2, you access the CCAC coordinator. If you press 3, you have the services of the nurse navigator. And by pressing 4, you have access to radiology. So through this single point of access, this really opens the door to a wide range of services that for the most part are available exclusively to Scope doctors. So through the internist, you may have access to the short stay unit for your patients that may need more immediate care. The CCAC coordinator can open the door to case management, to access to palliative care support if necessary. The nurse navigator is your entree point into the hospital system where you can have the services of an RN health coach for your patients who need chronic disease management, and a number of other interdisciplinary clinics. And imaging will allow you to speak directly with a radiologist and also to expedite any urgent imaging you might need for your patients. So I'm now going to turn it over to the team who will introduce themselves to you and let you know how they're available to help you.
Hi, I'm Tara O'Brien. I'm a general internist, and I am who you will speak with on the other end of the line when you call for general internal medicine on call. Press 1 with the Scope line. So we can provide general advice about your patients to help with management, as well as if you have an abnormal lab result, we can give advice on further workup. And if patients need urgent assessment and management, we can bring them into our acute ambulatory care unit at Women's College Hospital and provide rapid workup and management there. Some of the types of things that we can see are deep vein thrombosis or pulmonary embolism, new atrial fibrillation, or atypical chest pain or workup of syncope. An example of one of the patients that we have seen. This was an 86-year-old man who had recently been hospitalized for congestive heart failure, and his course was complicated by atrial fibrillation and worsening renal function. And then he was optimized and sent home, but after discharge, his weight gradually increased. Initially, he went up by about 2 kilograms, but then further increased by another 4 kilograms. And we saw him quite quickly and found him to be in heart failure. And we were able to diurese him over a couple of days and reduce his weight by 5 kilos. We also started him on a beta blocker to manage his atrial fibrillation. And we arranged ongoing follow-up in our case complex care clinic.
Hi, I'm Carrie Kozachenko, the CCAC coordinator attached to Scope. So when you call Scope and press option 2, you will either get myself or my colleague Leanne. So why would you call option 2? So please call us to refer any new patients to CCAC, and I accept just verbal information over the phone, so you can just either leave me a message with patient demographics and the reason for why you might want a referral, or you can fax the information to our Scope line, whatever is easier for your office. So we accept new referrals to CCAC, and also if you have a client who already has CCAC services and you just want an update on the care plan or what's happening in the community, Leanne or myself would be able to give you that information by connecting with the community coordinator or looking into our computer system and getting you that information. Another reason to contact the CCAC coordinator through Scope is just to find out about CCAC services or any other community supports. We have a lot of options available to support your clients in the community, and we can help liaise your clients with other organizations if they're for some reason not eligible or appropriate for CCAC at this time. A third reason to contact SCOPE CCAC is so that we could assist with coordinating care for your most complex patients, and that would be through the process of developing a coordinated care plan. And we would involve you and all the care team members for your patient as well as the patient themselves. So in general, we help coordinate your patient's care in the home and in the community. So whether your patient's already connected with service, you need updates or additional services, or if you have clients who have no supports and you want to know what they can access in the community, please give us a call. So I just wanted to go really quickly over a typical example of a call to the CCAC coordinator through SCOPE. So for one example, I had recently, a physician had a client in their office, and during the office visit, the client identified that he was having trouble just with his daily activities. So the physician picked up the phone and called SCOPE, got directly through to me, and what I was able to do then, so it was a verbal referral to CCAC on the phone. The next day I contacted the client directly. I did a CCAC intake assessment over the phone, and through that I was able to connect the client with our CCAC telehome care program to remotely monitor his CHF and connect him with the CCAC occupational therapist, which resulted in him getting the equipment he needed to safely manage his ADLs, his activities of daily living, like he got a bath bench and a walker, and also was able to connect him with a community support agency in his neighborhood that offered subsidized housekeeping service. Although that's not part of CCAC, we do a lot of linking with other community supports. So follow-up to that was the patient came back to the physician's office several months later and expressed satisfaction that he A, was able to walk better with his walker, and then B, was able to manage his daily tasks with greater comfort and ease following education from the OT and the new equipment, and he had not returned to the ED because his CHF was being well controlled by the telehome care nurses. So that was a satisfactory outcome in this case.
My name is Maggie. I'm the nurse navigator with SCOPE. I'm option number 3. As the nurse navigator, I serve as a point of access to connect primary care providers to appropriate community, clinical, and specialized supports to address complex patient health concerns. As a navigator, I'm a single point of contact that the primary care provider can link with when looking for various clinics and specialists. I communicate with the various clinics and specialist offices to clarify referral criteria, identify the resources they provide, as well as provide expected length of wait. As a nurse navigator, I can help enhance your workflow and communication pathways by communicating between you and your physician colleagues in the hospital settings by following up on the status of referrals, results, and specialist visits. I can also help navigate through SCOPE resources. So quick examples of when to access the SCOPE nurse will be to help you with specialist referrals, diabetes education, rapid diagnostic clinics for oncology, follow up on the status of referrals, results, and specialist visits, resources to assist with patient case management, and referrals for patients with newly diagnosed complex and chronic illnesses. The family physician connected with myself with SCOPE because they had a cervical lymph node biopsy that was positive for metastatic squamous cell carcinoma, and the family doctor wanted to know how to navigate through the system so that the patient gets the best of care. So I linked with the general internist, which is option number 1, and Dr. O'Brien was able to help by advising on that the family physician do a thorough skin exam, that the family physician link with SCOPE imaging for an urgent head and neck CT, and also for the family physician to be linked with a head and neck surgeon. So we linked him with Dr. Gulain, which was able to have the patient be seen by the end of that week. So the patient felt that the family physician was very happy with the care. They felt that it was very expeditious, and the patient was also very happy with how quickly he was looked after.
Oh, hi, my name is Heidi Roberts. I'm one of the radiologists involved in the 1-800 imaging project, or the SCOPE project. So some of you already might have spoken with me during the first phase of the project. Some of you probably will speak with me, or hopefully speak with me in the near future. So what is it that we are going to offer? The 1-800 imaging project essentially is a call center for primary care providers, and it's designed to improve the integration of the primary care providers with medical imaging. We have 4 pillars that we are working on. One is the appropriateness consult. So if you're wondering whether your patient should have a CT or an MRI or an ultrasound, which is the appropriate method that you should actually order for this patient, please give us a call. We're also happy to provide radiology consults for any kind of imaging reports that you have. And it doesn't really have to be from our institution. If you do have an imaging report and you don't understand what you are supposed to do with this, what's the next step, please, again, give us a call. We're also always happy to facilitate urgent imaging. If there is a patient in front of you who really think would benefit, or the patient's management would benefit from an urgent imaging, we are here to provide it and get the patient in at the same day, the same week, or the next week, whatever is the appropriate point of time for this patient. And again, we're also happy to facilitate urgent reporting. If you do know that an exam already has been done and you're waiting for the report in order to direct patient's management, we can facilitate the more urgent reporting of this exam. Or you have any other general questions regarding imaging, about the use of contrast, the dose, MRI compatibility of different devices. Again, we are here to answer all of your questions. So just please call the 1-800 imaging number and press 4. We are all happy to speak with you. So just imagine a patient in front of a primary care provider complaining about abdominal pain. And it's a young patient, and your suspicion is that the patient might have an appendicitis. But you're not really sure. It could also just be some non-specific symptoms. But you do know with the appropriate imaging, an appendicitis could be excluded. So you have 2 options. One is send the patient to the emergency department with the appropriate wait time for the patient and the utilization of our entire healthcare system. Or you could just get an appropriate imaging study right away. And if this excludes an appendicitis, you know that you can treat your patient conservatively. So give us a call, you get connected with a radiologist. The radiologist will briefly listen to the history of your patient, and we discuss the patient's case and triage it to the urgency, to the most appropriate imaging and according to the urgency of this patient. So all you have to do is you submit a requisition through the SCOPE service. The patient will get an urgent appointment. In the case of a suspected appendicitis, it would be on the same day. The patient would be seen urgently. You would get the report within a few hours, and hopefully an emergency department visit could be avoided.
So following this tutorial, you should check your email in the next 24 hours, as you will be sent the SCOPE number which you can begin to use. In the mail, you'll receive an exclusive SCOPE package with additional services for you and your office staff. We've managed to negotiate with the College of Family Physicians to obtain Mainpro-C credits for your use of SCOPE, at least the first time you use SCOPE. So with the first use of a SCOPE service, any one of those 4 SCOPE services that we outlined, you are eligible for 1 Mainpro-C credit. You complete the post-reflective exercise, and then you should receive your certificate of completion. So thank you for participating in this tutorial, and we wish you all the best with SCOPE.